Healthy San Francisco started prior to the ACA. It started in 2007. And at the time San Francisco was looking at this, it had a fundamental question that it was sort of wrestling and tussling with. One of, do you provide insurance or do you provide access to care? And the city really came to the conclusion that it couldn't afford insurance. And quite frankly, the situation that caused San Francisco to create Healthy San Francisco really hasn't changed at the local level for a lot of communities, where there are still hundreds of thousands of uninsured individuals ineligible for the ACA, and that there are ways to develop programs that are short of insurance but give people all of the features of what one might consider to be insurance, provides them with a medical home, provides them with the usual source of care, reduces their episodic care, and really helps them focus on improving their health status. And so from a national level, irrespective of, I think, sort of, in some ways, the implementation of Obamacare, I think we need to recognize we still have millions of people who need health care, and that the safety net system, be it either the public system or the community clinics, or quite frankly, private physicians who take one or two uninsured people, that there are still opportunities to improve the overall system for that remaining population. So I would say that. I would say that, this is sort of gets to the simplicity that Daisy mentioned. When we started down the venture of Healthy San Francisco, we were very clear. We did not want to spend a lot of money on administration. We did not spend a lot of money on brochures and flyers. To this day, I don't think anyone has seen a muni bus with Healthy San Francisco splattered over it, because I didn't have that kind of money. But what we focused on was creating a program that was simple for not only the individuals to use, but for providers. We spent a lot of time thinking about how to induce them to really serve a population that they hadn't ordinarily served before. I don't think many people know that Kaiser participates in Healthy San Francisco, Brown and Tolan participates in Healthy San Francisco, community clinics, other community clinics, they obviously participate, but a number of other private physicians groups. And so we really focused on trying to make it simple, because we know that administrative burden and the cost of administrative burden really deters participation across the board. And so we focused on that. And then I would say, in terms of sort of learnings, we spent a lot of time on trying to figure out from the beginning what we were trying to prove. We were trying to prove that you could create a system and improve health status without insurance. So from the get-go, we spent a lot of time thinking about what questions we were going to be held accountable for. We're investing all these additional public resources. Are we getting the results that we want from that investment? So we spent a lot of time thinking about the data that we wanted to collect and use to really show that we had improved health status. And so I think that on a national level, when we think about the expansion of health insurance to, 32 million individuals, really, I think over time, people are going to ask, have we seen an increase in health status, and on what measures? Have we seen an appreciable decrease in, the use of emergency rooms for what would be considered primary care conditions? Is the cost curve changing? And I think we've been able to prove that in San Francisco, and I think at the national level, we're going to have to do that also.